What's up, guys? Welcome back to my YouTube channel. Today I'm going to be showing you the new surgery update in Maple Hospital. So let's get right into it. So first we're going to become a surgeon. So there is appendicitis and tumor that we can take out. The tumor was the first one, now appendicitis is the new one. So I'm going to show you. So I think we're going to take Charlotte X and we're going to go to the scrub in. So let's get the surgical scrub and scrub in our hands. Also, do you guys like my outfit? I think it's really cute. So let's go into the surgery room, grab a sterile towel, throw it in the trash, and we're going to get a surgical gown, and now a mask. Now let's grab a clean sheet. And then now I have to wait for the patient to be brought in. So our surgical nurse is Andrea Y. So she's going to help us. So let's turn on the surgical lights and the secondary light. And now let's turn off the normal lights. Okay. So now we just have to wait till the surgical nurse is ready. Okay, so it's kind of glitching. Okay, there we go. Now she just has to get ready. Okay, now we're ready. So now I have to introduce herself. And now I have to give him some medicine. Now grab a sedative, which I already have in my inventory. And push a sedative into his IV so he can go to sleep. Well, she can go to sleep. And now do a saline flush. I can probably do it without this, so now I have to wait for him to wait for her to fall asleep. Place bowl. Now I have to wait till her to incubate Charlotte. Okay, now grab a bowl. Fill it with this type of surgical stuff. I don't know how to say it, but now let's sanitize the skin. Now we're going to make an incision. Now we're going to cauterize the bleeding with the bleeding tool. We have to do 3 spots. So I'm pretty sure this is appendicitis, but we'll see. So we have to make these, it's actually interactive. So what I'm doing on my screen right now is what I'm actually doing in real life. And I'm going to try to get the highest accuracy possible because I am level 238. So I want to try to do the best that I can. Okay, we're almost done cauterizing. Now let's open the muscle layer. And now let's cauterize more bleeding spots. Okay, so you're going to hear the buzzing. That's the cautery pen. Now we're going to clamp the base. Yeah, this is appendicitis. If you apply a second clamp, then it's an appendix. Okay, that's good enough. That was a little bad. So now I have to drop the appendix. Oh, my sign is in the way. Now cauterize more bleeding. So it's basically like the same steps over and over again. And if you do have some questions, you can write them in the comments. But if any of you had the question, can you get a code blue inside a surgery? Yes, you can get a code blue inside the surgery. And no, I haven't got one yet because I want to try to get the XP. So I'm trying to get to level 1000. So there we go. Now when she is taken to post-op, I'm going to show you what happens in the PACU or PACU. So now throw away everything. Oh, not the right time. Now throw away everything. Like that. And now we have to grab the appendix from the Mayo tray. And then we have to log the outcome when we're done. But I'm going to go to the PACU to show you what happens. See? just gonna shoot up. But we need this open now because when you see how much XP or the outcome, 56 XP. That's really good. So now I'm going to show you what you can do in the PACU or post-anesthesia care unit. Okay, so now let's put on an oxygen mask and we'll take her vitals or temperature and heart rate and blood pressure. But just right now, take temperature and heart rate, and then the second time, blood pressure. Heart rate. I feel like this really helps you if you don't know what you're doing. In Maple Hospital, the side, which I don't have to do, but it's just easier so you guys can see what's happening. So she just had a surgery. As we know, we just performed on her. So now we have to, probably IV pain med. Yep. So let's go over to Quix's medic stand, IV pain med. Okay. Now she's gonna probably not feel the greatest, but we're gonna assess her when she wakes up to know where she is and see if she's doing good. See, the patient is waking up, so go assess them. Hi, do you know where you are? She said, yeah, I'm in the hospital. I just had surgery. Good. What is your name? My name is Charlotte X. Okay. We're almost done. On a scale of 1 to 10, how's the pain? A 6. So now I have to check the bandage. I'm just going to check your bandage real quick. Take temperature. No signs of bleeding on her bandage. So that's really good. Now check your heart rate. So this is really helpful if you want the side open, but I probably don't need it open, but I'm going to let you guys see. So if you want to come and play, then you can see and know what you're doing. Okay. Okay, she's excited. We're just going to wait till it's done. 120/80. That's okay. You saw it's green, so it's good. But if it's bad, then it'll turn red. Okay, she feels like she might throw up, so we're gonna get some medicine. Wait, antonemic? I think that's how you say it, if I'm right. Yeah, antonemic, I think. Antimetic? I don't know. So we're just gonna get it anyways. Now we have it dispensed. Gonna give it to her. Now we're gonna type in how her bandage is doing. So chart. It says transfer criteria, no signs of bleeding, state blood pressure, heart rate, no sign of arrhythmias, shock, sepsis, or emergent delirium, no high-low temps. So arrhythmias are things in the heart that can move, and it's not healthy for them. So now, since she's doing okay, we're going to get Samuel W. to come and take Charlotte. And that's what you do. So thank you guys so much for watching. Until next time, guys. Bye.